Have you ever experienced intimacy that left you confused, asking, where did it go? This silent worry, often carried alone, is known as dry ejaculation, a condition many men face. I'm Dr. Evelyn Hart, a urologist with over 15 years dedicated to men's health, and I want you to know you are not alone. Dry ejaculation, medically termed anejaculation or retrograde ejaculation, means experiencing orgasm with little to no semen expelled. It's crucial to understand that orgasm sensation and fluid ejaculation are separate processes controlled by different nervous system parts. To grasp what goes wrong, let's first examine normal ejaculation, which involves a sophisticated internal plumbing system. During arousal, semen is produced, and at ejaculation, a tiny muscle called the bladder neck sphincter closes, sealing off the bladder. This closure creates a one-way track for semen out through the penis, a perfectly coordinated event. The most common cause of dry ejaculation is retrograde ejaculation, where this bladder neck switch fails to close. Instead of exiting, semen is pushed backward into the bladder, where it's harmlessly reabsorbed and expelled with urine. Why does this muscle fail to close? Often it's due to nerve damage, as seen in conditions like uncontrolled type 2 diabetes. High blood sugar can damage these delicate nerves over time, affecting the bladder neck's function. Other causes include certain surgeries like transurethral resection of the prostate or TURP, which can affect surrounding muscles and nerves. Medications such as alpha blockers used for high blood pressure or prostate issues can also relax the bladder neck muscle. Spinal cord injuries, multiple sclerosis, or even certain antidepressants can also contribute to dry ejaculation. The primary symptom is the absence of semen during orgasm or dry climax. Other telltale signs include cloudy or milky urine immediately after sex due to semen mixing with urine. Some men also report a noticeable reduction in the intensity of their orgasmic sensation. If you experience these symptoms, the most important step is not to panic, but to observe and prepare to talk to a professional. Diagnosis involves a detailed medical history, physical examination, and a non-invasive post-orgasmic urinalysis. Finding a high concentration of sperm in the urine confirms retrograde ejaculation. We are here to gather data to help you. Solutions depend on the underlying cause and whether fertility is a concern. If medication is the cause, adjusting or switching drugs under medical guidance can often resolve the issue. For neurological causes, medications like pseudoephedrine or imipramine can help tighten the bladder neck muscle. If fertility is a goal, sperm can be harvested from the bladder for procedures like intrauterine insemination or in vitro fertilization. This powerful solution has helped countless men become fathers, so do not let this condition deter your family dreams. Lifestyle changes are also crucial, especially for those with diabetes. Optimal blood sugar control prevents further nerve damage. A heart-healthy diet, regular exercise, and maintaining a healthy weight all contribute to good nerve and vascular health. Let's debunk some common myths. Dry ejaculation does not automatically mean infertility. Sperm can often still be viable for reproduction with medical assistance. Myth 2. This condition will ruin your sex life forever. Fact, the sensation of orgasm often remains, and intimacy can be fulfilling with communication. Myth 3, it's a sign of prostate cancer. Fact, retrograde ejaculation is rarely the first or only sign of prostate cancer. The emotional and psychological toll of this condition can be significant, shaking a man's sense of self. The bravest step is to talk about it, starting with your doctor and then openly with your partner. Explaining it simply, like, my body is ejaculating backwards into my bladder, removes shame and fosters support. If you've experienced persistent dry ejaculation for more than a few weeks, or if it causes anxiety, it's time to see a doctor. Your health and peace of mind are worth it. Schedule an appointment with your primary care physician or a urologist. Gentlemen, dry ejaculation can be frightening, but it is an explainable and often manageable condition. Knowledge is power. Understanding the why is the first step toward taking back control of your health. You have the right to understand your body, ask questions, and seek solutions without shame. Be proactive, be brave, and never stop seeking answers for your greatest asset, your health.